Hey everyone, welcome back to the Revenue Cycle Decoded podcast. I'm your host, Gina Cornett, and we are breaking down all things healthcare revenue cycle. Today, we're going to talk about an exciting and somewhat scary topic, but it's crucial for anyone working in revenue cycle management, and that is the future of revenue cycle. This landscape is really changing rapidly, and it is driven by new technologies and evolving healthcare models and shifting patient expectations. So, we're going to explore some of the key trends that are shaping the future of revenue cycle management and what they mean for you and your organization. So, let's get started. So first, let's talk about automation and artificial intelligence, or AI. It is all the talk, and it is showing up in every single revenue cycle journal that I get. These technologies promise to revolutionize the way we manage the revenue cycle, and their impact is only going to grow. We talked on other videos about how automation is helping to streamline routine tasks like billing, payment posting, coding, claims processing, denial management, making these processes faster and more accurate. AI is beginning to predict denials, optimize workflows, assist with coding, because it can analyze vast amounts of data quickly and accurately. And as these technologies become more integrated into revenue cycle management, they will free up time for us to focus on more strategic tasks. At the same time, it is going to completely change perhaps how we perform functions within revenue cycle management. No longer may a coder go out and pull a record and review the whole document and assign the codes. No longer may a biller put the codes on the claims. It could be a computer program that is doing it, and the coders may be responsible for teaching the computer program or catching errors that the AI makes, doing a final review. So we've always kind of had some of these programs running in the background, like scrubbers, where the coders go in, and if it hits a scrubber edit, the coder may review the documentation or issue a query to the provider. See examples of more of that. I see more and more organizations who have been letting go of their coding staff in favor of automated coding systems, but many of them aren't using anything at all. Again, it is going to really change up the processes, and it's going to be very interesting over the next few years to see how this changes our revenue cycle workforce and where our revenue cycle workforce puts its priorities. The second trend that is hitting revenue cycle management is the patient experience. As healthcare becomes more patient-centered, revenue cycle management has to become more patient-centered as well. Patients expect greater transparency and convenience when it comes to billing and payments. They want to know what they're going to be charged for services and procedures. No longer can we have a patient come to the window and say, "What's this going to cost me?" And we say, "We don't know, you'll get a bill on the back end." That is not going to fly in today's revenue cycle. We have to adopt patient-friendly practices. They need clear billing statements. They need clear estimates of what their costs are going to be. And those estimates should be really, really close to what the actual amount will be at the end. They need online payment portals and proactive communication about their patient financial responsibilities. They need to understand what they're going to owe and why they owe it. And if we're adding additional procedures or services that weren't included in an estimate, we need to be talking to our patients about what that's going to cost. Nobody wants to be given an estimate for $500 and get a final bill for $2,000. You wouldn't be happy about that if you were having your car worked on. You're not going to be happy about that if you're a patient having healthcare services. So a patient-centric revenue cycle approach, it doesn't just improve the patient experience, but it actually really enhances payment collection rates. Patients are more likely to pay if they know upfront and they're educated on their responsibilities and they feel confident that what you've quoted them is going to be pretty close to their final bill. Another major shift that we're seeing is the movement towards value-based care. And this trend is really changing how we approach revenue cycle management. In value-based model, providers are reimbursed based on outcomes rather than the volume of services provided. It's not a fee-for-service model. In other words, providers are being based on how their patients do and the quality of the care that they provide. So, for revenue cycle management professionals, this means navigating these new payment models, understanding quality metrics like MIPS and MVPs, and managing the financial risks that are associated with value based care. In many of these models, the provider's revenue is actually at risk if they don't meet certain quality or outcomes measures. So, to succeed in this environment, we need to understand and develop expertise in these reimbursement structures. And we need to really collaborate with our clinical teams to make sure that we are tracking and reporting the right data. So, speaking of data, data driven decision making is becoming the backbone of effective revenue cycle management. We have vast amounts of data. And up until now, it's pretty much been housed within disparate EMR systems that haven't really communicated with each other. But more and more, as more systems buy into big EMR, EHR systems like Epic, that information is going to be able to be communicated. And we can leverage analytics to make more informed decisions, identify trends, and optimize performance. So tracking key performance indicators or KPIs, that is critical. Using predictive analytics to anticipate challenges. Data is really helping us to improve accuracy and reduce our denials and optimize our cash flow. We really need to embrace these data-driven tools and strategies if we're going to stay competitive in the future. Another trend that we're seeing is the rise of telehealth and remote services. And those are trends that are here to stay, but that does come with new challenges. Billing for telehealth services is complex. There is a complex web of regulations and payer requirements, and it differs from Medicare to state Medicaid to commercial policies. As revenue cycle professionals, we really have to stay up to date on evolving telehealth billing codes. We need to be watching CMS and Congress to see what comes next in the realm of telehealth. And we need to ensure that we are compliant with state and federal regulations. This is a field that is going to continue to grow. It was used extensively during the pandemic years and has continued to be an option available for us. So as we move towards the end of 2024, it's going to be really interesting to see how we proceed as far as telehealth. But developing expertise in this area is crucial to managing that service effectively. And last, let's not forget about compliance. Healthcare regulations continue to become more complex, and we have to stay compliant. It is more important than ever. It is essential to avoiding penalties and ensuring our organizations continue to operate smoothly. We have to stay vigilant. We have to monitor regulatory changes. We need to have somebody in our organization who is looking at CMS, looking at state regulations, looking at federal regulations, and seeing what's coming around the bend. And then we need to implement robust processes to ensure that all aspects of the revenue cycle are aligned with those regulations. We're not just following the rules, we are protecting our organizations from those financial and reputational risks. So, there you have it, the key to trends shaping the future of revenue cycle management. Automation, AI, patient-centric billing, value-based care, data-driven decision-making, telehealth, and compliance. This landscape is always changing and evolving, and it's up to us to stay informed, to embrace innovation, and to adapt to these changes because they are coming. The future is challenging, but it is full of opportunities. If you found this video helpful, don't forget to give it a thumbs up, subscribe to the channel, and hit that notification bell so you never miss an update. And I would love to hear from you about your thoughts or questions on any of these trends. Please drop a comment below. Thanks for watching, and I'll see you next time. Peace out.